Hi, my name's Sabrina and I work in the emergency room at Stormontville Hospital. Would you know what to do if somebody collapsed in front of you from sudden cardiac arrest? If you come upon an adult, not a child, only an adult, in your home, in a grocery store, out in the public, anywhere, your first action should be to be able to make sure the patient has a pulse. Actually, the first thing you should do is to shake the patient and ask if they're okay. This is my dad, who is also my patient today. So if I was to come upon him and he's laying here and he's completely unresponsive, I would shake him and say, "Are you okay? Are you okay?" He's not answering me. I don't check for a radial pulse. I don't check for a brachial pulse. You need to first check at the patient's carotid artery, which is up, located on the neck underneath your chin. It can be located on either side of your neck. If you don't feel a pulse, you should go ahead and proceed with a hands-only CPR. This can only help your patient. In the middle of the patient's chest, right between the breast into the sternum, you're going to take the palm of your hand, press that down. You'll put the other hand inside of there, lock that hand, and you'll begin to push down on compressions. I'm obviously not going to do that on a real person, but you would begin to push hard and fast in the center of the chest. This is all you need to remember. In the middle of the chest, both hands hard and fast at a compressions of 100 per minute. This is what you need to start to do. You also need to remember to call 911. If there's somebody with you when you come upon this patient, you should instruct that person to pick up a phone or get to a nearest phone and get help to call for emergency services. If you yourself have a cell phone and you're by yourself when you come upon this patient, pick up your phone, dial 911, tell them you have an unresponsive patient, that you're going to begin hands-only CPR. That will activate the emergency response team. Continue to do compressions until emergency personnel arrive. This has proved to be just as effective and saved just as many lives as normal CPR, where you're doing airway and also compressions at the same time. When the emergency personnel arrive, they will then load the patient. They will continue CPR. They will provide airway. They will provide breathing for this patient and get them to an emergency room where they can seek attention from a physician. So if you come upon somebody, do not be afraid. You can only help them by doing this. Remember, this is only an adult, not a child. It's only if you see somebody outside of a hospital area, in a park, in your home, someplace like this. Do not be afraid of hurting them. Do not be afraid of cracking their ribs. Do not be afraid of anything. Check for a pulse on the side of the neck. If there's no pulse, dial 911. Have a person you're with dial 911. Begin immediately. Hands-only compressions in the center of the chest, fast and hard. Continue to do this until help arrives. If you have someone with you, it's better to do 1 or 2 rounds or until you become tired. Switch positions with the other person. Have them monitor the patient. You'll monitor the patient while they do CPR on this patient. You can check every couple minutes to see if the patient has a pulse. It will take several minutes for emergency services to arrive, usually 5 to 10 minutes depending on your location. But just remember, you cannot hurt the patient. You can only help them. It has been proved just as effective in that type of situation, and it has proved to save more lives from sudden cardiac arrest. So in conclusion, things to remember: if the patient goes down, check for a pulse, dial 911, begin CPR, hands only, middle of the chest. Thank you.